Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome to our weekly podcast, Redefining Medicine. We are excited to welcome Dr. Denise Bogard, an experienced internist and integrative functional medicine physician with a background in anesthesiology. Welcome, Dr. Bogard.
Thank you. Thank you. It's nice to be here.
Thank you. Dr. Bogard, you experienced firsthand the benefits of anti-aging medicine before turning your practice towards this approach. Can you share with us this health journey and how it impacted your career?
Certainly, Lindsay. So I was trained initially as a nurse anesthetist and then an anesthesiologist. And by the time I reached my early 50s, I had practiced anesthesia for about 30 years. Having worked in a hospital situation all along that path, I had done 24-hour call for 30 years, and it had taken its toll on my body. I was really experiencing a lot of fatigue, and I had gained like 20 pounds. And so it was through doing some exploring on my own that I found a physician in San Francisco that practiced healthy aging. And I started working with him back in 2010. And I worked with him for about 2.5 years, and I kept reading and studying and trying to acquire my own information. And it was at that point that I decided to go ahead and do the fellowship with the American Academy of Anti-Aging.
What response did you receive from your friends or colleagues, and how did you deal with any negative reactions, if any?
You know, to be honest with you, I've had a pretty good reception. I had a really good reputation in the medical community. So to this day, I get a lot of consults, especially from my OBGYN colleagues, because I look at the whole picture. I just don't look at the hormones. I look at the thyroid, adrenals, the GI tract, the cardiovascular system, the blood sugar. You know, I look at the whole picture. And so they know that if something's complicated, I'll dive in and I'll really, really do what I can to get to the bottom of whatever's going on. I have had a couple negative reviews from endocrinologists. And what I try to explain to my patients is they're looking through a different lens. If I just approach it from a traditional standpoint, we're taught at that point to diagnose, treat, and follow through disease. We're not trained to prevent disease. So I end up being a little bit more aggressive in my treatment towards a subclinical thyroid, a thyroid that's not functioning optimal. I've diagnosed like 14 parathyroid tumors in patients that had normal calciums, but what they do is they usually wait until the calcium goes up, and then they see the calcium up, and then look at the parathyroid. Whereas I'm doing things a little bit earlier and trying to prevent the disease. So the only really negative reviews I've had have been from a couple endocrinologists. Otherwise, in the community, I've been well respected. We have a local, it's called the Style Magazine, and every year they vote for best physician and best medical practice. 2 years ago, I got second in both of those. Last year, I got first in the best physician and second in best medical practice. So I was honored, to be able to serve our community this way and to have such a good reception from people. Most of my referrals are word of mouth as I take care of people and they get better. They tell other people and then they come and although we have done some things to optimize our website, and I am getting maybe about 20% of patients are just doing their own research and finding me that way.
Well, thank you and congratulations for coming in first place. That's very exciting.
Thank you.
Dr. Bogard, can you tell us more about your experience as an A4M fellow and maybe what advice you might give to listening clinicians who are considering starting their fellowship journey?
You know, I've actually mentored to some physicians in the area. Particularly just recently, one of my patients who's an OBGYN had looked at the fellowship, and I strongly encouraged her. And I encourage them to do all 8 modules, because every one of them are very, very valuable. And then the advanced, I've done a lot of advanced modules. I've done cardiovascular, I've done addiction, I've done stem cells, I've done IV nutrition and IV chelation. I've done pellets. So, you know, there's lots of additional education. Peptides. I've also done peptides. So, and then also mold. So I encourage people to do the fellowship. I tell them that, you know, the education they will get will be very, very, very good, very excellent. I recently have added to my practice ozone therapy. The theory behind it is ozone, which is 3 oxygen molecules, is a very unstable molecule. One of those oxygen molecules jumps off and it grabs things like free radicals, viruses, antigens, just toxins that normally would be floating around cancer cells. And it holds on to that, and then you're left with the 2 oxygen molecules. And it's very good for autoimmune diseases, viruses, cancer, just people that are just heavily loaded with toxins and you know, just loaded down. Healthy people use it. The 49ers actually use the ozone before their games. So they come in and get an ozone treatment to boost their performance. And so in sick people, you can use it as a module of treatment. In healthy people, you can use it just to jumpstart their, and again, improve their aging curve. Again, we are just bringing the service on, but it's something that I feel like will again be, you know, something to add and to improve, especially with my autoimmune patients. And I've got a lot of autoimmune patients. I take care of Hashimoto's. Between Hashimoto's and Graves' disease, I've got several hundred patients. And you know, I've got some rheumatoids, some MS patients. I've got a patient with ITP recently that came to me that I've been working on his immune system. So it's fun to help them and actually see these people get better. I could tell you the way I approach my workup is I look at what I try to describe to my patients is I break it down: adrenal, thyroid, sex hormones, GI, which is related to inflammation, cardiovascular, blood sugar, neurotransmitters, genetics, and lifestyle. And I tell people, think of it as a giant spider web. Every system affects every system. So my job is to figure out what's out of balance and help you put it back into balance. So, you know, my goal is to just help as many people improve their quality of life.
Well, thank you, Dr. Bogard, for sharing your insight and expertise. And we'd like to thank our listeners for tuning in to Redefining Medicine. Thank you so much, Dr. Bogard.
Thank you. Thanks a lot. And thanks to the A4M for their excellent staff.